Lisa Waddell, and I'm the founder and CEO of LFW Public Health Connections, which is a public health consulting firm. Prior to consulting, I had a phenomenal career as a preventive medicine and public health physician. I worked in local, state, and national public health and nonprofit organizations, so I've worked on a variety of public health issues, including issues regarding moms and babies. Just looking at the data and knowing that we have so many women, particularly women of color, who are dying as a result of pregnancy and childbirth, and issues such as high blood pressure, preeclampsia, eclampsia, we should be outraged. So many infants are dying before they reach their first year of life for things that are preventable. There are things that we can do to ensure that women and families are educated and have the kinds of supports that they need so that they are healthy and live, and that their infants are healthy and live. One of my sons was born preterm. Fortunately, we had great care and he had a great outcome. But my sister, for example, had preterm twins, and one died at birth and the other one died after 8 months. We're not alone in this. There are many families that have had tragic experiences like this. And so when you start to peel the onion back, you learn that there are issues around hospital closures that are happening in rural parts of the state, so that women don't have a place close by to even go for their delivery of their baby. We know that there are 15 counties that are in the state with no OBGYN providers. So we may have enough OBGYN providers in the state, but they are maldistributed more in the urban areas versus the rural areas. Certainly there are always the issues around education and health literacy, making sure that information is provided in a format that's more easily understood. And there's a need for providers to make sure they're taking the time to provide that information to women. Issues around access in terms of insurance, making sure that folks have insurance and they have a way to see providers. And then transportation, particularly in rural parts of the state, a real problem where in an urban area, maybe you can get to a provider for your prenatal care, your delivery, and your postpartum care within a 9 to 10 mile radius. But in rural parts of the state, that can be 40 to 60 miles, right? And so that's a long time. And so these are all kinds of things that we need to look at. What are those issues, and then how can we begin to address some of those? It takes a lot of collaboration, it takes partnerships, it takes looking at the systems, and it's not about blaming the mom, because oftentimes that's how she may feel, but there are often things that are contributing to what happened. 94% of these maternal deaths are preventable. And one of the key issues is we have to know our numbers. And one of the important issues is around high blood pressure. So you always want to be as healthy as you can before pregnancy, but then during pregnancy, of course, providers are monitoring the blood pressure. But if you're someone who's never seen a provider or had access to a provider, you may not know that your blood pressure may be high. Many of the poor outcomes actually happen after delivery. And so we have to remember that we're hugging and we're loving on the baby, those new babies, but we gotta make sure mom is doing okay too, and that she continues to need that care up to at least 1 year after birth, that blood pressure is being monitored. If she has diabetes, that's being cared for, and all of those other supports, because often there are issues around perinatal depression, mental health kinds of challenges. So it takes a lot of support for the infants to live and thrive, and it takes support for the mom to live and to thrive, and we need to work on both of those.